Hi, I'm Dr. Monica Burrell, Commissioner of the Massachusetts Department of Public Health. This has been a bad flu season, and we know people are concerned. I want to ensure you that we at the Department of Public Health are working aggressively to make sure you know what you need to know to protect yourself, your loved ones, and the public. I'm here today with Dr. Al DeMaria, State Medical Director and State Epidemiologist in our Bureau of Infectious Disease and Laboratory Sciences. Here's Dr. DeMaria.
Thank you, Commissioner. Influenza is bad every year, but this is a particularly bad season, and it's important that people know what they can do to protect themselves and their family members, friends, and the public. The things that people can do start with infection control, prevention, coughing into your sleeves, not into your hands, because your hands can get contaminated and spread the virus around. Also, washing your hands, very important, because the way the virus gets to infect you is because your contaminated hands touch your face, your nose, your eyes, and the virus can get in that way. So these are very important prevention interventions that people can do to reduce their risk of getting the virus and reduce transmitting the virus. The other thing is getting the influenza vaccine. Now, the influenza vaccine is not all that we would hope it could be in terms of preventing influenza, but for the time being, it's the best that we have. And now we're seeing an increase in influenza B, a second strain of influenza viruses emerging this year. And all indications are that the vaccine is very effective for that strain, and still effective for the strain that has been circulating so widely and causing significant disease. And the vaccine itself, even if it doesn't prevent you from getting the infection, can reduce the risk of the complications of the infection. So it's very important for people, especially those who have underlying conditions that put them at risk, to get the vaccine, to do whatever they can to prevent getting the infection in the first place, and for the people around them to do everything they can do to reduce their risk of getting the infection and bringing it home to those at risk. And then, if you do get influenza, there are medications, antiviral medications, which can reduce the illness by about 1 day, but in people with underlying conditions that put them at risk of complications, it can reduce the risk of hospitalization. It can reduce the risk of those complications. So it's something that really needs to be discussed with your healthcare provider. And after this season is over, remember how bad it was, and remember next fall when perhaps it's not on the news, but you can get a flu shot early in the season. Remember how bad it was this year, because it can be bad again next year. It can be bad years after that, and we have to respect influenza as a significant cause of illness and death in the United States, and do whatever we can to reduce its impact.